Okay, so I am doing a presentation on figure one from an article titled Superior Efficacy of Combination Antibiotic Therapy versus Monotherapy in a Mouse Model of Lyme Disease. Some quick background. Lyme disease is caused by a bacteria called Borrelia burgdorferi, which can stay in the body even after treatment. This study wants to investigate different combinations of antibiotic treatments as opposed to the monotherapy to see if it'll help clear those long-term infections. And then this was done specifically in mice. So this is a two-part figure. This is part A. This is basically just a general timeline. They infected the mice. They waited about 2 months where the mice were untreated to allow the infection to grow. And then they were split into two groups, just the control where the mice received monotherapy, and then they also had a group that received different types of combination therapy. Um, and then they waited 2 more months and tested each of the mice to see if the infection persisted. And this is just a way to mimic long-term infection in humans. So then this is the second part, part B. This is a flow chart that shows whether the bacteria was present. Along the bottom, you may have remembered in the first part that it mentioned something about xenodiagnostics, which shows up down here. So basically, they allowed uninfected ticks to feed on the mice, and then they tested those ticks to see if they had the bacteria, and they used PCR to do this. And then across the top, you can see their tissue testing. Basically, they just took tissue samples from organs like the ears, the heart, the spleen. You can see them all there. They placed them in a growth medium and incubated them and then inspected for bacteria. Sometimes blood tests can show up as a false negative, and so that's why the tissues were the more important part. They did run blood tests, but it wasn't as important to the overall study. Um, and then they used PCR or RT-PCR to test these tissue samples. Basically, it's just a molecular test for the bacterial DNA and RNA, and it just confirms the infection status in the tissues. And then here at the end in the green and the red boxes, it's showing the end result, whether they were positive for the bacteria or negative. And this just helped them lead to the conclusion of whether the infection persisted or was eliminated after these different types of therapies. And then here is my source.